clothianidine, hydralazine, beta blockers such as metoprolol, anticholinergics, a variety of other medications, anxiolytics, antipsychotics, all those may be associated with erectile dysfunction. Okay, now moving on to ejaculation problems. Someone could be dealing with premature ejaculation or retrograde ejaculation. So premature ejaculation is defined as having ejaculation prematurely sooner than desired, either before or shortly after penetration. And it happens to around 20 to 30% of men. For retrograde ejaculation is basically when the semen travels toward the bladder instead of exiting through the penis, which many cases result in infertility. But I want to point out here is that when you suspect retrograde ejaculation, usually the urine could be collected right after ejaculation, which in this case would reveal high amount of sperm count, and usually that urine could be collected to obtain some viable sperm and use it for artificial insemination. So it is a possible intervention. So for pharmacotherapy, I will not delve into details. Of course, I would leave it to the PathoPharm class. However, I want you to know that medications such as Viagra comes with side effects, such as headache, flushing. Most importantly, this is contraindicated for those who are taking nitrate therapy. Nitroglycerin, Imdur, it is contraindicated. They should not be taking Viagra while on nitrates. I will talk a little bit about penile implant and negative pressure devices as option in the next slides. So for penile implant is an option for erectile dysfunction. Basically, they are surgically implanted rods within the erection chambers of the penis. The rods vary. They could be inflatable or could be bendable, malleable. When they are bendable or malleable, usually the penis is always kept in a semi-rigid condition. However, a lot of people these days would choose the hydraulic or the inflatable prosthesis, which basically allow them to have an erection whenever they choose. It's more natural, easier to conceal. The negative pressure devices are other option to treat erectile dysfunction. It's a device that will induce erection, and the way it is done, it's a plastic cylinder that is placed over the flaccid penis, and you apply negative pressure. So you will increase this negative pressure until erection is attained, and then you take away that plastic cylinder and leave a constriction band in place to maintain erection. And then one important teaching point for individuals who use this negative pressure device is not to leave the constrictive band for more than an hour, because there is a risk of tissue injury. It is somehow contraindicated for those who have maybe clotting disorders, those who have altered in pain perception. They need to consult their providers, because they might have this constricting device in place, forget about it, and not feel that it's constricting them and cause tissue injury. Now let us talk about conditions that involve the prostate glands. So inflammation of the prostate is called prostatitis, and it's basically inflammation that is caused by an infectious agent. So similarly to UTI, an infection that reside in the urinary tract, that's infectious agent that reside in the prostate. And similarly, you treat it with an anti-infective agent, so that pain that is there will go away once you treat it appropriately. Similarly to what we talked today, when it comes to treating UTI, you treat it with an antibiotic, the pain will go away. Now, for benign prostatic hyperplasia, it's a very common occurrence. It affects around half of men greater than 50 years of age, 80% of men greater than 80 years of age. Remember today when we talked about gerontologic consideration, older adult individuals tend to have their prostate is expected to enlarge. So the manifestations would be signs and symptoms of urinary obstruction. Remember, the prostate kind of hugs the bladder, sits on the neck of the bladder. So when it gets enlarged, it's blocking the urine flowing from the bladder, leading to urinary retention and urinary tract infection. So look for those signs and symptoms of UTIs. Remember, older adult individuals will have fatigue, change in mental status as some of the signs and symptoms of a UTI. The way we treat the BPH, alpha blockers, anti-androgen agents, sometimes we catheterize if they're unable to void, and sometimes with a prostate surgery. Now, prostate cancer. It is the second most common cause of cancer death among men. Risk factors, I would like you to know that: increasing in age, familial predisposition, and African American race. Very important in terms of manifestation. At the early onset of the disease, there is barely any symptoms, and here where screening, health screening, is an important issue. What do we call health screening? The secondary prevention. We're looking for the presence of the disease before symptoms take place. We want to catch that problem early on. As I mentioned, symptoms would be urinary obstruction, sometimes blood in the urine. Remember, asymptomatic, painless hematuria, one of the, actually that was bladder cancer. But anyway, blood in the urine or in the semen, and painful ejaculation. Early diagnosis is very vital. Health screening is very important. Treatment strategy could include resection of the prostate, could include radiation therapy, chemotherapy, hormonal therapy. So you have several types of prostatectomies. And I want you to know that radical prostatectomy is considered the standard first-line therapy treatment for prostate cancer, especially if the cancer is localized in the prostate glands. Now, this type of surgery, the radical prostatectomy, involves the complete surgical removal of the prostate, seminal vesicle, some of the vas deferens, several blood vessels, surrounding fat and nerves. In addition to that, now what's becoming more of a standard surgical approach is doing laparoscopic radical prostatectomy and robotic assisted laparoscopic radical prostatectomy. So it's definitely it has been more of a standard doing the robotic one these days, especially if the cancer is localized within the prostate. Now, know that side effect of prostatectomy, a common side effect is impotence, sexual dysfunction, but know that doing the surgery has been definitely been associated with low morbidities and definitely more favorable post-operative outcomes. Now, transurethral resection of the prostate is now considered very common, maybe the most common procedure that is used, and it is done through endoscopy. And how we do it, the prostate gland is basically removed in small chips with an electrical cutting loop. So it's pretty common these days to do that. So TURP rarely is associated with sexual dysfunction erectile dysfunction after the procedure. However, it has been reported association with retrograde ejaculation, because think about it, there is this procedure involved removal of the prostatic tissue, And where the prostate sits at the bladder neck, and this may cause the seminal fluid to flow backward towards the bladder instead of forward toward the urethra. The suprapubic prostatectomy is basically an open surgical procedure. It's like any other major abdominal surgical procedure. Comes with its own risks, such as blood loss, infection, and things like that. Now, perineal prostatectomy, it comes with some side effects, and mainly incontinence, sexual dysfunction, sometimes rectal injury. It is done if other approaches are not possible, it's done instead. It's helpful if you're trying to get a biopsy. So the transurethral incision of the prostate is basically done when the prostate gland is really small. And in many cases it is used with BPH. It has much lower complication when comparing it with the more invasive procedures. So when caring for someone who's going to have prostatectomy, so we already know they have some kind of prostate issue, we really need to do the regular assessment that we do for everyone. First, identifying the problem, what led to his problem, what changes it had on their lifestyle. Have a more of comprehensive assessment that is related to urinary and sexual function. What kind of symptoms did they have? Did they have signs and symptoms of urinary obstruction, frequency? Did they have any hematuria? Did they have any flank pain, back pain? Did they have any sexual dysfunction? Health history in general, their functional status, their nutritional status. What activities are they able to do? Was there any limitation to their activities as a result of this condition? And so forth. So when it comes to nursing care, several things we need to keep in mind. Top priority is relieving and alleviating anxiety. So not only anxiety, but sometimes not knowing what's coming next. Also think about feeling of embarrassment and shame. Their patients tend to always or sometimes associate patients tend to sometimes associate sexual practices with their current problems, and make sure to provide some education in that area. So as I said, it's a sensitive topic, and because of the site where the surgery is, make sure you provide privacy to the patient. So when it comes to pain, you do expect pain post-operatively. However, I find it extremely important to really provide or do the proper assessment for the pain, because as you may know, this pain could be a surgical incisional pain, or it could be something that needs a different kind of intervention. So is it an incisional pain, or is it a pain that is related to a bladder spasm? Do they have any flank pain to tell us there is a problem with the kidney function? Is it a pain related to excoriation in the skin as a result of the catheter sites? It's important to really understand the background and the etiology of that pain. So, for example, if you suspect bladder spasms, the patient will report more urgency to void, feeling some kind of fullness or pressure within the bladder, maybe bleeding from the urethra around the catheter site, and in this case, the patient will not need necessarily an analgesic, but will need a spasmodic, something like Ditropan. Things that would help: warm sitz bath. Other things that would need to be done in case you suspect some kind of urinary obstruction would be to irrigate the drainage. And typically we do that with a 50 ml, some irrigating fluid at a time. Make sure whatever you